If you have had lymph nodes removed or irradiated in a sentinel node biopsy or an axillary lymph node dissection for breast cancer, then you are at risk for upper extremity lymphedema. And this comes from damage to the lymph nodes or lymphatic system and can result in swelling of the affected site. So typically it is on the arm that you've had lymph nodes removed or irradiated, but it can also be in the chest and in the lat area, especially if there has been external beam radiation, which essentially is going to go through like a sandwich. Unfortunately, this may be the best kept or worst kept secret for breast cancer patients and survivors because so many people are never told about lymphedema. There are many ways that you can prevent lymphedema, and one of them is exercise and lymphatic drainage. So we want to optimize the flow of lymphatic fluid and open up the potentially restricted pathways so that the lymphatic fluid can circulate as it did prior to the damage. So I'm going to show you some very basic exercises that you can and should do prior to your exercise session. So whether it be you going for a jog or whether you're going to do Zumba or even weight training, you always want to begin with a 5-minute cardiovascular warm-up, and that could be marching in place if that's all you can do. That is just perfectly fine. Alternatively, you might get on your exercise bike or throw on a video and exercise along with that, but do at least 5 minutes. You can do more if you'd like. But one of the most important and often overlooked things as well is that you need to start and progress slowly because we don't know what your lymphatic system can handle now. So even if you were a marathon runner previously, your body may not be able to tolerate that right away. You have to gradually add your time, you have to gradually add intensity, and even the frequency of your workouts. So I want you to start off just with some deep breathing. And what I usually do is I place one hand on my chest and one on my belly. And I inhale so that my belly expands until it can't expand anymore. Then I pull that up into my lungs. And then very slowly let that go. And I might repeat that 5 to 10 times. So this is preparation for the next set of exercises we're doing. Now, if you are able, you can lie on your back with your knees bent and feet on the floor, and you can do some pelvic tilts, simply pressing the small of your back to the floor. Hold it for a couple seconds and relax. Repeat that 5 to 10 times, and then even some crunches, lying on your back, of course, and make sure that your chin is level. And if this hurts your neck or you have any other reasons you should not do those 2 exercises, then skip them. Just do the deep breathing. From there, you're going to go ahead and you are going to start off with some neck stretches. So I'm going to just place my hand on the opposite ear and put my other arm behind my back. Now, if you can't do that because of surgery, just let your arm hang down. You can even pull up on the chair and feel that very gentle stretch through here. We want to hold that for 20 to 30 seconds. Then you're going to tilt your nose to your armpit, move the hand to the back of the head, and also hold that. And I'm not pulling on my head. What I'm doing is I'm depressing here. Imagine an arrow pushing down. My hand, it's just the weight of my hand on my head, okay? And then I'm going to do the same thing on the other side for 20 to 30 seconds and 20 to 30 seconds. Next, I'll tuck my chin to my chest and same thing. Okay, from there, I want you to do shoulder raises all the way up and all the way down, as if somebody's pushing on your shoulders. Nice deep breathing, always breathing, okay? And then we're gonna do shoulder rolls. And notice I'm doing this in a chair. You can do this sitting, you can do this standing, and then we're gonna go backwards. Now, if any of these are uncomfortable or you're just physically unable to do them, then skip it. It's okay. Don't cause yourself any additional pain. In fact, I'm dealing with a shoulder injury right now, so it's very difficult for me to raise my arm up. So it's okay. I'll lower it down and squeeze my shoulder blades together, hold it for a couple seconds, and relax. Now, pull your belly button into your spine as you're doing this, and breathe. Okay, if you can only do 3 of these, then do 3 of these. That's okay. Next, we are going to go to an isometric chest press. I want you to think about squeezing bananas under your armpits and push your palms together. Feel the pectoral muscles, which are right here, contract and relax. Keep your breathing going. Push your hands together. Good. Think about pumping that lymphatic fluid through your system. Okay. Now this next one may be difficult for some of you. If you can't keep your arms up here, then you can skip this one. We're going to do forward circles, and then we're going to do backward circles. And there's no magic number here. You know, it could be 5, it could be 10. Now we're going to let gravity work for us. And I'm going to try and back up so you can see what I'm doing here. And I am going to start off with circles. So I'm going to do clockwise and counterclockwise. Okay, and what we started off doing with the breathing was we were helping to move any lymphatic fluid that was pooling in our torso. So now when we're using gravity to help drain the lymph, it has some place to go. So after you do your circles in each direction, then I want you to think of a hammer. Okay, and it could be like this, it could be like this. And lastly, you're going to use those fists and squeeze, 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 pushing that lymphatic fluid out of your arms, back into your torso to circulate throughout your body. And now you're ready to do your exercises. So remember, range of motion first. You can check our YouTube channel, Cancer Exercise, to see some very basic exercise progressions for improving range of motion following mastectomy, reconstruction, and radiation. And after you have your range of motion back in all planes of motion, then you definitely want to begin to do strength training exercises. We all are at an increased risk for osteoporosis as we age, but particularly if you are in menopause or you are forced into menopause from chemotherapy or hormonal therapy, your risk is elevated. If you'd like to learn more, please visit thecancerspecialist.com or ceti.teachable.com.